was totally deceitful. They knew exactly what they were doing.
BC has reached a multi-million-dollar settlement with a major opioid manufacturer accused of fueling the overdose crisis in North America with deceptive marketing of its opioids since the 90s. In 2018, BC took on a class action lawsuit on behalf of the whole country.
I can announce that we reached a $150 million settlement with Purdue Pharma Canada. This is the largest settlement of a governmental healthcare cost claim in Canadian history.
There's lots of issues with $150 million. Number one, will they get it? Number two, will it even cover the costs of the damage it did to our medical system? Number three, it does not bring my son back or the thousands of people that have died subsequent to becoming addicted to Oxycontin.
Helen Jennings' son, Tyler, died in 2016 from an overdose.
In 2010, he ruptured his Achilles tendon badly and had surgery and was sent home with a prescription for Oxycontin.
The situation snowballed over 5 years. Tyler became addicted to the pills. His doctors took him off them, so he bought them on the street. Then, after his brother died from a prescription drug overdose, Tyler started using heroin.
He searched out a dealer and he thought he had bought heroin, but it was 100% fentanyl. There wasn't a grain of heroin in it. So he died.
BC Attorney General David Eby says the financial cost of the opioid crisis on the Canadian healthcare system is in the billions of dollars.
We took this action to recover healthcare costs and to hold opioid companies to account for their part in allegedly engaging in deceptive marketing tactics to increase sales, which led to increased rates of addiction and overdose.
According to the U.S. National Library of Medicine, Purdue Pharma increased its sales of Oxycontin from $48 million to $1.1 billion from 1996 to the year 2000. The company has since pled guilty to misbranding and fraud charges. In the United States, the claims against Purdue are in the trillions of dollars and have bankrupted the company's U.S. arm. Eby says he didn't want the company to dismantle its Canadian arm to pay for those U.S. claims, potentially leaving BC with nothing.
The money will be going to supporting provincial programs to fight the opioid epidemic. This amount is not going to fully compensate taxpayers for the expenses that have resulted.
And it won't bring back Jennings' son. Tyler left behind 2 kids, now being raised by his mom, who hopes the settlement money goes into substance use support.
This is my son and this is his son. He's 18 now. He was 12 when his dad died.
BC will now work with the other provinces and the federal government to divide the settlement. In Vancouver, Kier Junos, City News.